All right, thank you so much, Carlos. Well, their escapades of infidelity are notorious. Celebrities like Tiger Woods, Charlie Sheen, David Duchovny, and Russell Brand. Now, new research shows that these Romeos may be suffering from a legitimate disease, hypersexual disorder, and hypersexual disorder may soon have a listing as a legitimate diagnosis in the DSM-5. That is the so-called Bible of psychiatry. Now, joining me right now is one of the lead researchers, Dr. Reid, psychologist, and we thank you so much for being here today. You know, when we hear about these cases, and I just mentioned a couple of names, people say it's an excuse. Is this really a disease, or are people just using it as a reason to misbehave?
Well, I think one thing that we sometimes misunderstand is just because someone has a diagnosis, it doesn't necessarily remove them from consequences. Drug addicts get arrested, pathological gamblers lose their house to foreclosures, and a lot of people that struggle with this issue lose jobs, they have relationships dissolve, and so forth. So they don't avoid the consequences, but it does pave the way for them to get help.
Dr. Reid, define for us exactly what it is and what help is available.
What hypersexual disorder is it's a persistent pattern of excessive sexual behavior that's being used as a way to escape uncomfortable moods, to cope with stress. People report not being able to control their behavior. They also experience a lot of consequences and significant distress in their lives as a result of these sexual fantasies, urges, and behaviors.
Are you hoping that if there is an actual diagnosis for this, that you'll be able to help people in a way? Would you treat them with medicine? Would it be with therapy? Some people would say you just need to show self-restraint.
What I think creating a diagnosis does is it allows us to, first of all, be on the same page in terms of what we call it. That allows researchers to come together, study the same thing, and then we also look at treatments. Medications can certainly be one avenue of research, but we also look at behavioral therapies and other things that might be helpful to reduce the symptoms these individuals experience.
And we're nearly out of time, but would you treat it like you would somebody who has a problem with drinking too much or an addiction to drugs?
I think there's a lot of common denominators between treatments that are successful with addictions like substance abuse or gambling and people that struggle with these issues. So that's certainly a first place to look.
Dr. Reid, we thank you so much for being here
Thank
with us
you.
live on Studio 11.